Welcome back to the France 24 newsroom in Paris. I'm Tom Burgess-Watson. Thank you very much for joining us. First, according to the latest tallies, the number of known cases of the coronavirus across the globe has just topped 100,000. That's according to a tally kept by the Reuters news agency. Well, more than 3,300 other people are so far known to have lost their lives since the outbreak began, the vast majority of them in mainland China. But in what's seen as a positive sign, no new cases have been reported in the last day in the Chinese city of Wuhan, where the outbreak first began. Meanwhile, South Africa, Bosnia, Serbia and Bhutan in the last 24 hours joined the list of 80 or so other countries in reporting infections. Well, as governments across the globe seek to contain its spread, health ministers across the European Union are gathered for talks in Brussels. Well, let's get the latest on those talks and we can cross to France 24's Dave Keating. Dave, what are they talking about? What's been agreed on?
Well, the health ministers have finished their meeting and they've agreed a couple of things. One is funding for research into finding a vaccine and or treatment. That'll be 37.5 million euros available from the EU budget for those efforts. They've also reached an agreement on joint procurement of devices that would be needed to combat the spread of the virus. At this stage, mainly face masks. There has been disagreement. Italy requested under the EU Civil Protection Mechanism that other EU member states send them face masks. Other EU member states were hesitant to do so because they were worried about running out of face masks themselves when they might need them later. And so they've agreed, 20 EU member states have agreed to jointly procure those face masks in order to have enough for everyone. Now, the EU health ministers have also identified the crisis here as moving into a new phase. They acknowledge that the infections that are being seen now seem to be within countries, not being imported from outside, from other countries. So we are seeing spreading within EU countries, which represents a new phase, they said, and a new way of looking at this going forward. The main focus of this meeting was to coordinate efforts because there's been a lot of different actions taken by different member states so far. And some have questioned some of those actions. For instance, Italy's decision to close schools and universities. Some have asked, why is Italy doing that when the virus is known to really represent a danger to elderly people, not so far as we can tell, to children. So they're looking to better coordinate all of the EU member states' actions. There were questions about whether the EU could put in some kind of emergency legislation in order to be able to tell member states what to do, something it can't do at the moment. But the EU Health Commissioner said that, in fact, the situation is so different in different EU member states, it's better that member states take their own actions with the knowledge that the virus is going to increase at different stages. And so she said, when you're looking at what's happening in Italy right now, other member states should learn lessons because they may reach that stage at a later point.
And just briefly, I mean, we've just passed the 100,000 mark worldwide, according to a Reuters tally. The numbers are up here in France again in the last 24 hours. There must be a sense things are going to get worse before they get better, David.
Yeah, we did get an updated figures from the EU health officials, and the confirmed cases right now are 4,000 in the European Union, and that figure has risen a lot since the last time health ministers met in late February. They were talking about just 50 cases. Now we're at 4,000. The virus is even spreading here within the EU institutions, where reportedly the Croatian EU ambassador, which is leading the EU's presidency right now, is in quarantine because she came into contact with someone here at the European Council in this very building. So EU officials definitely seeing this ramping up, looking at a different phase, a new phase of trying to contain the virus. The message that the EU officials had at the press conference was that EU citizens have a part to play in this. They need to be following the recommendations of the WHO and the ECDC in terms of frequent hand washing, in terms of limiting social contact, and that there's no need to panic at this point, because if everyone plays their role and the EU sticks together, that they can beat this. That was another big message coming out of this meeting of health ministers: coordinated actions, solidarity, and the EU kind of grappling with this crisis as a whole in a coordinated way.
OK, Dave Keating in Brussels, thank you very much indeed.